Well, good morning. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're really excited that you've joined us today for the J1 Visa webinar, waiver webinar, sorry, the J1 Visa waiver program and program updates webinar. Before we begin, I would like to discuss a few housekeeping items. Our webinar is hosted in Microsoft Teams, and if you're not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen. The webinar will be recorded today and posted on our website in approximately 7 to 10 business days. Today, the chat option will be open during the presentation, and we'll answer all your questions in the Q&A session at the end of this webinar. And then the slide deck will also be posted on our website 7 to 10 business days, and a link can be found in the chat box to our website and the other resources. And with that, I am thrilled to introduce Jolanda Granville, our Policy Section Chief with Health Workforce.
Good morning, everyone. I'm Jolanda Granville. Thank you, Chris, so much. Thank you for joining us today for our J1 Visa Waiver Program updates. This session is intended to provide understanding of the changes to the California J1 Visa Waiver Program, to demonstrate how to determine if a site is located within a shortage designation area, and we're also offering some Q&A regarding the California J1 Visa Waiver Program. Our mission at HCAI is to expand equitable access to quality, affordable health care for all Californians through resilient facilities, actionable information, and the health workforce each community needs. Our vision is a healthier California where all receive equitable, affordable, and quality health care. HCAI was established in 1978 as OSHPD, or the Office of Healthcare Workforce, Office of Statewide Health Planning and Development, to ensure healthcare accessibility within California. In 2021, we transitioned to the Department of Healthcare Access and Information to reflect a growing portfolio and a more descriptive name. Our office, the Health Workforce Development Office, supports and increases a health workforce that serves medically underserved areas, represents the California it serves through racial and language diversity, and serves Medi-Cal members. Our programs offer financial support for organizations expanding educational capacity, individuals pursuing health careers via our scholarship and loan repayment programs, and organizations that help build the health workforce pipeline. If you would like to find out if your organization or if you're an individual who's eligible for any of our programs, you can take our eligibility quiz on our website at the link provided on this slide. Today's presenters will be Gloria Robertson, Program Coordinator for the J1 Visa Waiver Program, and Darby Moss from our State Primary Care Office, Shortage Designation Unit. And below you'll see an email address for any questions regarding the J1 Visa Waiver Program. So now I'm going to hand this presentation over to Gloria Robertson.
Good morning, everyone. I am Gloria Robertson, one of the program coordinators for the J1 Visa Program. Today we're looking at Conrad 30 J1 Visa Waiver. State Departments of Health may recommend up to 30 waivers per year. Recommendations to approve a waiver request are sent to the Department of State. Department of State will submit its approval of the recommendation to the United States Citizenship and Immigration Services for final determination. Time commitment of service is 3 years. The application cycle begins October 1st through 31st and December 1st through 31st if needed. Note that October 1st was yesterday, so the application cycle is open. Employer eligibility. Facility must be located in the health professional shortage area, or HIPS as we sometimes think, mental health professional shortage area, medically underserved area, or a medically underserved population. Physician eligibility. Primary care physicians who have completed their training programs in one of the following disciplines: family medicine, general pediatrics, obstetrics and gynecology, internal medicine, psychiatry. Specialties are in subspecialties that provide direct patient care are also eligible to apply. Advantages of J1 visa waiver physicians. Retention. Your hospital or clinic can keep a physician for at least 3 years and possibly 5 with a national interest waiver. Experience. Typically, physicians with a J1 visa waiver have more experience practicing medicine. Become a part of the community with their families. Recruiting and retention. Please know that these are 2 resources that you can find for in terms of recruiting, retention, and looking for a job. The HRSA, Health Workforce Connector, or the 3RNet program. Both of these resources are located at the end of our slide should you want to copy them down. And next, I believe we're going to have presentations by Mr. Darby Mass, the other co-program coordinator. Mr. Mass.
Good morning. Thank you so much, Gloria. Today, I'm going to be talking about the program updates. The first thing we're going to be talking about are the application period. As stated already, the application is open. This is for both primary care and specialists. It will go through the month of October, ending on October 31st. The priorities will be given to rural practice sites, and applications are reviewed in order of receipt. If there are slots available, a secondary application cycle will open from December 1st, 2023 through the end of the year on December 31st. For program updates in terms of the application requirements, number 1, employers may only submit up to 3 applications per organization or practice site each year. If slots remain available after the first application cycle, employers who have exceeded the 3 application limit may apply for additional waivers starting December 1st. Number 2, employers must show evidence of 6 months of recruitment attempts for that vacant position. Number 3, to be eligible under a medically underserved area / medically underserved population or MUA/MUP designation, the last update date for the designation must be within the last 4 years. And 4, for the current application cycle, a grace period will be provided for applicants who can prove they accepted a job prior to us announcing the J1 visa waiver program changes on August 23rd, 2023. Lastly, we're going to be talking about the application submission process. Number 1, all applications must be sent by email in PDF format to J1 Visa Waiver Program at hcai.ca.gov. Number 2, the programs affected are the Conrad 30 J1 Visa Waiver Program, the Health and Human Services, or HHS J1 Visa Waiver Program, and the Physician National Interest Waiver, or NIW. Next, I would like to be able to demonstrate a tool for everybody on how to find your shortage area if you are in a HPSA or not. First of all, on the screen, you can see here, I have an address for Adventist Health Howard Memorial Hospital. I'm now going to go in and show a demonstration for Adventist Health Tehachapi Valley Hospital. Okay, so the first thing you'll do, and I kind of started this already, is you're going to put in the street address. In this case, it's 115 West E Street. And the city is Tehachapi. and then choose the, oh, that's right. Okay, so what you see here on the screen is some great information. On the left-hand side, you can see if the address you put in is in any or are in any HPSAs are related to that. And in this case, you have a dental health HPSA, you have a mental health HPSA, and a primary care HPSA. So all three. But what I really want to demonstrate today is this map over here. So by pulling back on this map a little bit and getting a broader sense of the general area, we can look at a couple different things. So now we're out a little bit. You can see all these little things are numbered and everything. Those are the HPSA designations. And then you can use this layering tool over here, and you can kind of take things out and put things in. So let's say we want to get rid of the dental and the mental, and we're just going to look at the primary, which is applicable to most. So what I want to do is, okay, so you can see all the green here is primary, but we have this spot over here that is not. So in this case, if you know someone practicing or your location ends up being in this area and you think, yeah, we should be designated, then you're going to want to contact the California Primary Care Office at their shortage inbox, which is on the link slide. This will give you an opportunity to contact them and ask if you can also be part of HPSA designation. So at the end of that demonstration now, I'm going to talk about an opportunity to get more information. We have our 31st annual Fall HPSA Designation Workshop. That is coming in, that is actually next week in Monterey, California. And the dates are the 12th and the 13th for that. And it will be a time when we can get together with all our stakeholders and talk to you about what a designation is, what are the advantages of a designation. We'll also have partners there to present with us. So on the screen now you can see there's also a link here for our workshop flyer and a link for how to RSVP for the workshop. Now I'm going to give it back to Chris Rowena for a question and answer time.
All right, thank you so much, Darby and Gloria. Well done on that. We're going to transition to our question and answer session. And today we have the chat box open, and so you can ask your questions in the chat. And I also believe we've got a small enough contingent today. If you're unable to access the chat due to your company policy, go ahead and raise your hand, and we should be able to work on that as well. Chat is now open, and we will answer questions in the order that you received, and we'll do our best to answer all the questions that you have today. And let's see. Go ahead, and know we've got a few people out there, so if you've got questions, this is your chance to ask them with the experts on online with us right now. Give people a second to think about it. Also, if you don't have a question right now, but you do end up thinking of one, we also have the email address, j1visawaiver@hci.ca.gov. You can see the link in the chat right now. And I've got our first question. All right, thank you. Can fully remote radiology be considered for the specialist category?
Yeah, this is a great question. Thank you. At this point, California is not accepting fully remote work or any kind of telehealth.
All right, great question. Thank you for the question and the answer, Darby. Next question. My organization needs to have their MUA/P classification updated. Is there any way to predict whether they will meet the requirements?
Yeah, again, another great question. We've had a lot of questions about MUAs and MUPs since we made these changes. Our J1 visa waiver program does not deal with the MUA, MUP designations. That is our primary care office side. There is a link in the links section to contact the shortest designation, and then they can help you determine the MUA, MUP status, and then getting that updated.
All right, thank you. And I believe let's get that shortage email posted in the chat as well. I believe it's shortage at hci.ca.gov. We will make sure that's posted in the chat as well for easy access for that. All right, next question. How long does the process usually take?
The process on our side, we receive an application, and once the window closes, depending on how many applications we have, we try to get that done within 21 days. And then after that, we send it to the Department of State. It is out of our hands at that point. We don't have any other parts of the process. So after that, I'm not sure how long it takes for. I think it depends probably on how many applications the Department of State is also reviewing at the time. So that would be more of a question for them, unfortunately.
All right, thank you, Darby. Next question, how much vacation is allowed? Does the 40-hour per week requirement need to be averaged over a period of time?
In terms of vacation, I believe that is again, once that is reviewed by us and moves on to USCIS for the final determination, then anytime you have some sort of period where you're not meeting that 40 hours per week, such as in this case, a vacation, that would need to be worked out with them in terms of will it extend that 3-year commitment or shorten it or anything like that. So that is more of a question that maybe between you, your immigration attorney that you're working with as an employer, and the employee would work out.
All right, thank you, Darby. Next question, based on the new requirements, to the best of your knowledge, will any of the UC hospitals qualify for Conrad 30 waivers?
Having not looked at the applications yet and review them, I don't have an answer to that. I believe I don't have an answer. Some hospitals, USC did qualify last year, so some university-related hospitals did, but I didn't see any kind of UC hospitals last year.
All right, thank you, Darby. The next question, can you send out the slides to the attendees? Yes, we can and we will. We will be, once we have the recording transcribed and we put the captions on it, about 7 to 10 days, we will be sending out an email to everybody registered for this to include both the slide deck and the recording for the webinar. All right. It will also be posted on our webpage. All right. John asks, are state mental hospitals / correctional facilities subject to the HCAI and the MUA/MUP provider ratio?
Yeah, another great question about the MUAs and MUPs. That is correct. State mental hospitals, correctional facilities, any facilities that are within an MUA are subject to the updated information that needs to happen for MUA, MUP provider ratio. Mental health hospitals, correctional facilities also qualify under facility designations. And again, that would need to be done through the primary care office. So reach out to them through Shortage. And then that's how we see it on our side when we look and review those.
All right. Thank you, Darby. Next question. Will you be having additional seminars regarding visa information in the near future?
At this time, we do not have anything planned on this, but please reach out and let us know if you found this helpful. And we would love to provide another opportunity such as this in the future.
All right. Thank you. Next question. Are you considering including Flex 10 slots like other states, especially given geographic mobility in California?
We are not at this time considering adding any flex spots.
All right, thanks. These are great questions. And we've still got some time left in the webinar. So if you have any more, keep them coming. All right. Comment here. Yes, more information is needed. An in-person seminar would be very helpful.
It's a great idea. Thank you.
All right.
Hey, Chris.
Yeah.
Sorry to pop in. I'm curious to find out from the folks who want additional information, specifically what they are looking for and what we could. I mean, there may be subject matter or questions that are beyond our area of expertise, and so I'm kind of curious to find out if there's folks we need to partner with that could help folks that are interested in this program that need more guidance than what we're able to provide. Is there any way to perhaps unmute Anuit or Cecilia?
Yeah, we should be able to get somebody if somebody wants to raise their hand to answer that question, or they can put it in the chat. Jelena, that's a great
if they don't feel comfortable, that's fine. We can get a hold of them offline, but I just wanted to provide them with that opportunity because we do take these inquiries very seriously. So
yeah, absolutely. Yeah, I see in the chat there's a contact there. It says we can talk offline on that more, and I think that's a great way we can get any information. And for everybody online, please, if you have feedback or questions, please email us. We do take these very seriously, and your input is very important to us. So please utilize the resources that we're here for you. Next question, Sherry asks, do you provide regular updates on how many slots have been used and how many are available?
Yes, we do. What we do is as soon as we have processed or reviewed an application, we'll make sure to post we've this many slots have been taken so far, and then you'll know, minus 30 or whatever out of that, and you'll know how many we have left.
All right, and I see we do have a hand raised. So let's go ahead and let's see here. Are you able to unmute yourself? Niranjan?
Yeah, now I can. Hey, this is
Excellent.
Niranjan. Actually, I'll be one of the candidate who would be looking for a waiver, I guess. My question is like when we use that interactive map to look for underserved area, it was showing like a physician, like a primary care, mental health, and dental. That primary care map, does that include subspecialty as well?
Yes. Yeah, so long as for your specialty, if you're working in primary care and that's where your subspecialty is, then that's under primary care HCAI.
Okay, sure. Thank you.
You're welcome.
All right, thank you for the question. Eno asks, what is the reason for remote work telemedicine not being considered, especially if there are available spots and no one is filling?
Yes, another great question. Telehealth is a very, very hot topic right now amongst all these programs. And right now, for us, we don't have the capacity in terms of being able to monitor the telehealth to make sure it's getting to the correct populations. And so that's one reason why telehealth is being limited. In California, we are having discussions about what that might look like in the future, but at this point, telehealth, telemedicine is not being accepted.
All right, thank you, Darby. Got time for one or two more questions if we've got them any left. And these are great questions. Thank you, everybody, for your participation. We really appreciate it. Like I said, your feedback is very valuable for us in how we go about administering these programs. All right. Well, if there's no other questions today, I want to thank everybody for your participation. And again, if you do, please email us at J1 Visa Waiver Program. Oh, we got one more coming in. See, wait. Okay. Awesome. Thank you. It was mentioned in the primary care areas apply for subspecialties with primary care. What about subspecialties like radiology?
Radiology is outside of primary care. Go ahead and work with your immigration attorney and your employer to determine where, because it doesn't fall within mental, it doesn't fall. So that's why most will apply under primary care.
All right. Thank you. And a note again, we will be sending this out and it will be posted on our webpage. So thank you again for everyone. As a reminder, it'll be about 7 to 10 business days and we will have everything posted for you and emailed out. We appreciate everybody joining us today to learn more about the J1 Visa webinar program, waiver program. We're excited to be able to offer it as a part of our health workforce development efforts at HCAI and are grateful for your participation with us today. The following screens provide some of the links for the resources that are available. We encourage you to go to our website to read all of the great resources that HCAI offers. As a reminder, the J1 Visa waiver application closes October 31st. We really look forward to your submissions and hope that you can join us at the HCAI workshop October 12th through 13th in Monterey. Thank you so much for attending. And with that, we conclude today's webinar. Have a wonderful day.